Cardiopulmonary bypass is a process by which systemic venous blood is taken from the patient, transferred to a pump oxygenator, and delivered back to the patient's arterial circulation. Cardiopulmonary bypass, or CPB, can be performed either at normothermia or by cooling the patient to 30 to 28 degrees centigrade, or even as low as 15 to 18 degrees centigrade in preparation for complete circulatory arrest. Cardioplegia is induced by a high potassium containing solution which causes electromechanical arrest of the myocardium. Electromechanical arrest decreases myocardial oxygen utilization substantially. It is said that there is a 90% decrease in myocardial oxygen utilization by simply keeping the heart at a standstill. An additional 10% decrease in myocardial oxygen consumption is achieved by cooling the myocardium. Cardiopulmonary bypass is not physiologic. It results in several metabolic derangements, including a bleeding tendency secondary to platelet sequestration, clumping in the oxygenator, and diffuse systemic inflammatory reaction with third spacing. This is why anticoagulation and antifibrinolysis is required. Aortic cannulation is usually accomplished in the ascending aorta distal to the intended cross-clamp site but proximal to the takeoff of the brachiocephalic artery. Subsequently, venous cannulation is performed through the appendage of the right atrium with the distal tip of the cannula positioned in the inferior vena cava, thereby allowing for drainage of both the IVC and the right atrium. Alternatively, the superior vena cava and the inferior vena cava can be separately cannulated through the right atrium. Such bicapal cannulation is used when it is necessary to enter the right atrium to perform the surgical procedure, i.e. a tricuspid valve operation. The surgeon may also place a cannula through the wall of the right atrium into the coronary sinus before the onset of cardiopulmonary bypass. This cannula will be used for the delivery of retrograde cardioplegia during CPB. Specific cannulation configurations will depend on the surgery to be performed. After cannulation and confirmation of adequate systemic anticoagulation, the patient is now ready for transition to cardiopulmonary bypass. The surgeon at this point can perform her surgical incision into the heart, such as an aortotomy, for the purpose of a surgical aortic valve replacement and operate in a bloodless field. To recap, the key steps in preparation for cardiopulmonary bypass are systemic anticoagulation, antifibrinolytic administration,